Our next topic, the COVID-19 vaccine. Recently, there was a plan released about how that will be distributed, because obviously once we get a vaccine, it's going to be a very limited quantity. So there was a plan put out in Kentucky about who will get it first. So what does that look like, at least to start, and when do we expect to see this?
Oh, that's the million-dollar question. You know, we've heard rumors, frankly, that's where I'll couch them right now, that maybe we'll get a first vaccine through within the next couple of months. There are a lot of regulatory hurdles. That would be unprecedented speed. And so even if we get there, how many doses will be available, you know, in a country of 220 million people? So that's ramping up that kind of production until we get second or third vaccine in place. It will be slow, right? So obviously it'll be first responders, healthcare workers, those kind of folks that are having the most interaction with folks, and maybe even some of the most unprotected interaction with folks. So those will be the kind of first sort of rollout. We expect, I mean, if we're doing well, it's a year rollout, just because of the complexity. Each of the vaccines, they're all 2-dose vaccines. They don't all have the same time period of when you get from the first to the second dose. You can't start with one vaccine and finish with another. So the complexity of keeping up with all of that for individuals and for healthcare providers and systems, that is probably the most difficult logistical challenge of all of this that we're going to see. Contract tracing wasn't necessarily fun, and Dr. Stack is a rock star, but this is really complex to try to keep up with those different timelines, different vaccines, who gets first in line, all of those things. And it was stepped out in a plan, but all of that will depend on how quickly production can be ramped up. Different vaccines get stored at different temperatures. I mean, it is going to be one of those unprecedented logistical challenges. You know, like we've been dealing with, we're dealing with a 100-year pandemic that we've not seen. So all of that is learning, and I think we have, right? I think we have learned a lot, and we'll continue to learn. But like I say, that's going to be one of probably the biggest challenges we'll see.
Unprecedented, I think, is the perfect word to use for all of what's about to happen.
Right, yeah.
We've been dealing with unprecedented speed in terms of trying to turn a vaccine around,
oh my gosh,
and then trying to get it distributed. But to that point, I mean, people are normally okay with flu vaccines and things like that, but this is, how are people going to feel safe enough to even get it? You know, how is the government, either Kentucky or nationally, going to be able to tell people this is safe? Even though there's multiple things going around, like you said, they have to be stored differently. I think people are going to be very concerned. So I think that's another logistical problem that you guys are going to face. Do you agree?
Oh my gosh, yes. You know, we have our challenges with people doing this, right? And we'll have some campaigns, and we will demonstrate and hopefully lead by example of taking the vaccine when it becomes available, to show that it's safe. And hopefully, you know, the phase 3 trials are a big deal, and to get through all of that is really should give folks some assurance that we will see something out on the street that's safe. But like I say, it'll have to be by example. We'll do some campaigns on it. I'm sure there'll be national campaigns on it, and hopefully Chamber of Commerce, you know, all of the folks, we're going to have to lead by example. This is what we're going to have to do. And you all have been great partners with all of this. So, and I thank you for that.
Absolutely. Let's talk cost real quick. You know, I wanted to talk cost last time. I'm talking about budgetary implications. Like the testing, is this going to be paid for by the state? Will people need to have their insurance pay for the vaccine? Is it paid by federal dollars? And you may not have these answers right now, but I think especially when we say the state will distribute it, that sounds like the state is kind of paying for it and it's done and don't worry about the cost or your insurance. So what does that look like?
The short answer is I don't know. The
Okay.
long, the long answer is this. The federal government administration has said they are going to pay for that, and folks shouldn't need to pay for the vaccine. There will have to be, I think, some legislation to provide relief to the states and to healthcare providers for the actual administration of this, which is going to be so very complex. There is a distributor that has been selected by the federal government that is going to be responsible for getting it out across the country. I know they're in place. But the challenge is all that documentation, all the infrastructure that's going to need to go into place to support that. There's going to need to be some assurance that those costs will be covered. We've got some of that, but we're going to need more. There's just no doubt about that. And like everything that happens, even with testing, we have done in Kentucky what we can do to make sure that there are no cost options for folks across the Commonwealth. There's still some folks then who may get tested through their own insurance that may have some copay sort of things going on. And we've been trying to work with folks to not have that. But sometimes that slips through the cracks and it does happen. But I assume we'll see something similar with this.
So you kind of said a year rollout for the vaccine distribution. And like you said, a lot of them are 2-dose things. So this is going to take a long time.
Yes, it is.
But what is a normal person who doesn't work in healthcare, doesn't work on the front line, when can they expect to maybe be able to get the vaccine? And in the meantime, and this is probably more of a Dr. Stack question, the second part, where are we at on a treatment? Because I think that would make people feel even more comfortable in the meantime. I think that's almost as vitally important as a vaccine in a lot of ways. So when can a normal person expect to be able to get the vaccine, and where are we at on a treatment?
It depends. I think best case scenario, when you look at the ramp up graph, right, which I think was in Dr. Stack's presentation, the 6 to 9 month window, I think, is where you'd start to look at that best case scenario. But that's after a vaccine is approved, probably more than one is approved, the third one's approved, what all that ramp up is for that production. So I'm being over optimistic there. I think honestly, I probably am. I would lean more towards the 9. And then in terms of treatment, the most effective thing, and I'm not a physician, do not play one on TV. The most effective thing we found is that a steroid that has been around forever, that kind of speeds all the processes up. That's been the most effective thing we've seen so far. The monoclonal pieces that have come out, it's still too early to say. I believe. So I know folks are working on effective treatments, but we're not there yet.
Anything else on this topic, on COVID-19, on the vaccine, on anything, especially as cases have been ramping up lately, and there's more. I think that people felt really comfortable, and now they're kind of questioning it. So anything else on this topic that you want to say, just to wrap this up, or that you want Kentuckians to know?
I hate to say it this way, but we should all still be really uncomfortable. As a matter of fact, we should probably be more uncomfortable today than we have ever been. When you look at that curve of increasing cases, that's not the right shape. And we have not had that in Kentucky yet, but now we do. So even though we are tired, and even though businesses have really taken a hit, this is as critical a time as we faced. Herd immunity does not exist, right? This is such an infectious agent that it just doesn't exist. We won't get there. So there are pieces of folks, getting reinfected after a few months. Some folks that we know. So I know people are tired of this. I know they're tired of it. I swear I know. But wearing this, social distancing, I don't think we can touch each other by reaching out. That we've got to do that. Simple things, how you wash your hands, remember the 20 seconds, sing the birthday song, do the hand sanitizer, and really minimizing your contacts. So that's the other way to think about it. I know we've kind of said it before, but each person you come in contact, this is the way I think about it. Each person you come in contact with comes in contact with several other people, and they come in contact. How do you limit that circle and think about it in a way that's intentional? And we all need to be thinking about that. How do we limit our sphere, right? Our sphere of folks that we touch. It's not the way, we're always thinking about, how do I network more? And how do I broaden my network? Just the opposite. How do I shrink my network? How do I shrink my network of contacts? That's what I'd encourage people to do. Wear a mask, all of those things that are very important. If you see someplace and in public and it looks like it's too crowded, don't go. But I don't have any greater words of wisdom than that. I wish I did.